Hello everybody, my name is Manvir and I'm joined today with 3 students and we're going to be talking a bit more about placements. So if you guys introduce yourselves, we will start off with Mervyn.
So my name's Mervyn and I did my placement in Peterborough City Hospital, and my senior clinical supervisor was James Honey, and I had 2 clinical supervisors as well, and yeah, it was a good opportunity for me.
And my name is Myrna, and I did my placement at UHL, specifically Glenfield Hospital. My senior clinical supervisor was Anna Delph, and yeah, basically.
And my name's Hannah. I also did my placement at Glenfield Hospital. My senior clinical supervisor was also Anna, and my clinical supervisor was Asmita.
Good. So you guys are all from hospital then, yeah?
Yeah.
And the whole point of this is that we will have 2 segments. So this segment we'll talk a bit about hospital pharmacy, and then community pharmacy has its own segment, and the whole purpose of that is because we want to give you guys the opportunity to really express sort of your feelings towards the placements, and then obviously the community students should have the same opportunity as well. So talk me through how it felt. So when you went into day 1, is this the first time you guys ever been in hospital pharmacy, or have you been before?
Oh.
My first time hospital pharmacy.
First time?
Yeah, first time for me too.
Yeah.
This first time as well, I was excited because finally get to see how everything operates.
Yeah. So when you started day 1, how did you find it? But also think about leading up to day 1 in terms of what did the university do, or how was that transition from becoming first-year students that have only been in workshops and seminars and things like that, transitioning from that to then being, you're on a ward or in a dispensary. How did you find that transition?
I know from our first week at placement, it was actually more induction. So obviously, when we're doing induction, it wasn't the experience side of things. So when it was induction week, I didn't feel too worried. But the university did prepare us for actual placement by giving us training. I don't know if you guys remember, but they did give us training modules and things like that to complete.
As well as preparatory sessions, I think about a month or 2 before placement, where we had one every week, I think, or one every 2 weeks, where they talked us more in depth about what professionalism is, and what professionalism wear is, what we should wear on placement, and as well introductory onto the portfolio site as well, which was quite new to us, we haven't seen before.
Yeah, and during placement, I was always with my senior clinical supervisor or my 2 clinical supervisors, and they never pushed me to the deep end. They would always slowly ease me into the transition, so it did feel comfortable having that, because it's 13 weeks. We had a long time to settle in, which was convenient.
When you started, you had your induction phase where you would go through introduction and just standard operating procedures, I guess, right?
Yeah.
Where did you go after that then? Did you go sort of into the dispensary, or was it onto the wards? How did you, where did you go? So
for me, I had a timetable set by my senior clinical supervisor. So after my induction week, I went into the stores where they store all the medications. So I was with the people, the pharmacy support workers who were in charge of that, and they would just guide me through the week, walk me through that day, and make me part of the team as well. So I would engage in activities like storing away the medications.
Yeah.
And then one of our MKM tasks was about storage medications. So while I was in that week, I would research about why these medicines are stored at these specific conditions. So yeah. Okay.
And how about you guys?
Yeah, for us, it was also timetables. So I know me and Myrna were actually split.
Yeah.
So I was with another student who was also at Glenfield, and I was on a rotation with her. Myrna was actually by herself when she was at Glenfield.
Yeah.
But how it worked was that when she was in the dispensary to start with, me and the other girl were on wards. So we kind of rotated I think 4 weeks, was it?
Yeah, it was a 4-week block
weeks?
of each.
Yeah. 4-week block of dispensary for her, and then whilst that happens, I'm on a 4 weeks of wards, and then vice versa, for the remaining 4 weeks.
Yeah.
And then for the remaining days, weeks after that, it would be half days.
Half day of this, half day of that.
Yeah.
So it was still split between us. We still were not together. So in the morning, for example, if I was on wards, you would be in dispensary, and then vice versa in the afternoon.
Yeah.
Yeah, I think my experience was different because I had a week for each individual like department of pharmacy. So 1 week in stores and like 4 weeks for dispensary to like learn about the processes, because the software they use in each hospital is different. So it takes a while. So I was used for having like 4 weeks to learn about dispensary, and I would every now and then get the chance to go back to dispensary. So after my 4 weeks, I was able to go on wards.
Yeah.
So during that ward time, I was able to go back to dispensary as well. And I was with my supervisors in ward, just observing like different clinical conditions.
Yeah.
Yeah.
So you spent a lot of time then in different areas, I think, and it's fair to say that because you spent 4 weeks in dispensary and then several other weeks on wards. How do you feel that the times that you were given, so overall you was given 13 weeks, do you think that was good or bad, or what were your feelings towards that in terms of your learning process of the different areas of hospital pharmacy?
We've learnt a lot, so the time we spent there, although it was like in blocks at the beginning, but we all can agree like the time we spent on wards, especially pharmacists, we've learnt a lot with that.
Yeah.
So the pharmacists used to go in detail with us about like different conditions, and then just go through like patients and review them, and like in-depth talk about why they review these patients and what like they're looking for when they're reviewing patients, especially if they're like staying in hospital a couple more days. So we got more like in-depth look at medications and why patients sometimes need to be switched over to other medications rather than the others. So it was a lot of clinical during the ward time.
Yeah.
So
We were talking to real patients, so we got the experience and the confidence. So now if I'm doing a practice like OSCE or something, I'm going to feel more confident because I've actually talked to real patients about it.
yeah, it's not going to sound really scary anymore. Like I remember the first time we walked into like these SCA exams, we were like really nervous, but I feel like with the ones coming up now, we shouldn't be too worried about it, since they're just going to be actors as well. We actually spoke to real patients with like different sorts of like challenges basically.
And also like it taught us to adapt to the situation, because like in uni we do learn to adapt to the patient, but we always like follow a script that's been taught. Like for me, just because we want to pass it, but this placement highlighted how patient may be going through emotional distress, and you got to adapt to their needs, which this placement did highlight. And I'm going to try implement that in my OSCEs, because in my mind in OSCEs I do think they're actors, but I'm going to try reflect it on how it would be as a patient, so benefit me more.
Yeah, because in the case of an OSCE, you know that it's an exam and you need to pass the exam. I think when you go into placement, especially a long placement like this, you have that opportunity to really explore different ways of communicating and interacting with patients.
Yeah. Like you don't just stick to a script, because people will say things that are out of script. So even if you come across a patient who doesn't want to speak to you, how are you gonna like say, can I come back later? Or I don't know, like they don't speak your language. You have to talk with the carers. There are different like things you have to work out the actual way that you're gonna be doing it in real life, not just how you're gonna do it in OSCE. So I think this gave you like the proper experience, like how you're gonna be doing it.
Giving us like a good setting stone to like adapt to different situations, like because we're gonna have more placement in the future, so now we know what we need to do to adapt to like different patients, because they have all sorts of needs, and we just gotta like make sure it's patient specific. And
was there any case or any patient interaction where you thought it really threw you off?
I think I had that interaction. I think it was with my very first like patient I've spoken to when I went on ward. Like I was still like doing the like assessment for the medicine reconciliation, so the drug history assessment. So I was still being like supervised by a pharmacy technician. But my first patient for that was like a patient with hearing difficulties. So I was trying, as much as I thought I was loud enough, I did not want to be loud enough for other patients to hear, but I didn't realize that the patient generally could not hear me. So the patient could not hear me at all. So like the pharmacy technician had to step in and basically complete the drug history for me. It threw me really off, because I thought I was loud. Like I thought I was loud, but like it was not really enough for that patient. So I think from that like experience, it just taught me like that with every patient, I need to like really make sure that patient is able to hear and understand you. That's all. That's what it matters, I guess.
When that technician stepped in, then how did that make you feel?
I felt kind of disappointed, because I thought I was at that point, because I felt like I was confident enough to go and speak to a patient. I think I gave myself a whole day just shadowing technicians. I refused to go speak to a patient before I was confident enough. So for that to be my first experience and then not doing so well in it, I just felt disappointed. But I think it was like a learning curve for me. So like I've learned that not everything goes well from the first time. It takes a couple of tries. So that was obviously my first try.
Yeah.
So, but from then on, I've just learned to adapt to every patient, and I managed to do it like really well after that. So
when the technician stepped in, obviously, even thinking about it, that would make me feel it would make me lose my confidence, because you think I should have been able to do that. And so, you lose your confidence. But then how did you, after that, build that confidence back up then?
I think for me, I tried to go, I tried to go for easier patients after that.
Yeah.
So I tried to look for patients that were not so difficult to do the drug histories on. Obviously, I had to do on all patients, but I tried to go through first at the beginning to build my confidence back up, to go for easier patients, and then through doing them successfully, then I managed to like build enough confidence to go back and going for like more challenging patients, and speak to them. And after that, because from that first experience, I managed to learn a lot from that. So then when I went for challenging patients, it was not so hard after that. I did it well, and I was more excited to do more drug histories. Like I was looking forward to do more, basically after that.
I think confidence was a big thing. Like when starting, I think dispensing, I found more okay. Because it's just you're not actually like directly talking to patients. But when we're on wards, I feel like there were angry patients, and it's not as easy as you say in OSCEs. But I was trying to initially memorize what order to say things, because there is a certain order that I'm taking a drug history. So I tried to learn, okay, this is what I asked first, this is what I asked next. But I didn't get that first, straight away. So it took many tries, but eventually, when you do it more and more, your confidence increases.
Yeah. In terms of clinical cases, did you see things where you thought, this is extremely interesting?
So I had a lady, she would come, apparently the pharmacist was familiar with this patient. I wasn't familiar, it was my 4 weeks in, but this lady would get admitted to the ward seeking opioid medicines, pain relief medicines, and I wasn't aware this was a thing. I would think no one would do this, but it made me aware how drug abuse, addiction is a real problem, and it affects real people. I
saw someone with legs swelling, ankle swelling, and you could see that, and you'll learn about this as first years, but pitting edema. So actually a nurse is the one who said, come and poke the swelling, and it was just an indentation there. That was really interesting, because this is the kind of stuff you learn about, and when you see it in real life, it's just reinforcing your knowledge as well. So that was something interesting I saw.
Yeah, I think definitely when you see it compared to when you're taught it, it's very different.
Yeah.
If you say pitting edema, you don't really know what that means. You know what it means, but you don't really know what it means. But obviously, if you've gone and poked the person, then you'll know what it is.
I think I've had similar experiences as well. Not so very interesting, but for me, what I found myself interesting was seeing hemodialysis, things that we have not been through yet in year 1, and just learning. I've got to shadow a session where a nurse was doing it from start to end. I am kind of scared of blood, but I was trying to myself as hard as possible to go and see a patient, trying to see how it's done and what it is, because I didn't know what it was. You just hear people, they're doing hemodialysis or they're doing dialysis, but you don't know that there's many different types of dialysis. I think I've seen 2 at hospital. But then it was really interesting seeing the hemodialysis, they actually take out the blood to kind of clean it up and then put it back into the person. Then it's really interesting because they have so much what is it called, procedures to keep the machine clean, because anything could go inside the patient and cause them harm. So it was just really interesting seeing that.
So did you move around different clinical areas then?
Yeah.
What would you say was an area that you thought was really cool or you really enjoyed it?
I think for me myself, I really enjoyed like my time in cardio wards.
same.
It just feels like there's so many things you can learn about like cardio, like the heart and the different conditions. I also enjoyed my time at renal as well. So there was just these two were kind of like my kind of most favorite
Yeah.
specialties at the hospital like
Same.
that we had at Glenfield, because
Yeah.
we have like 4 specialties in there, I think.
Yeah, there's quite a few.
Yeah.
So cardio for me as well, because we're also familiar with a lot of the medications
Yeah.
that we learned
Yes.
about in first
It
year.
You would've
just
covered
felt
it.
like it was something that we kind of knew, we were confident
Yeah.
about, and it just it felt like we could understand more.
Yeah, yeah.
And that's why
You could understand more, because when they're talking about stuff in other wards, like renal wards, you don't really can't picture it. You don't understand
Yeah.
it. So if you
Mhm.
haven't got that foundation, you're not going to understand anything they're building on top of it.
Yeah.
So we understood that in cardio mainly.
Mhm.
Even if we did, I feel like cardio especially because it's easier to get your head around blood pressure, hypertension, all these medications as well.
Or even
So-
like patients with like heart attacks and stuff.
Oh,
So it
yeah.
was like really nice to see like many different medications patients are on. But as well,
Yeah.
like when with renal, why I found that very interesting, because it's something I was very new to. Like in the first year, like during the academic year, we have not been through renal yet. So
Yeah.
I just felt like I was learning something new. So it was kind of interesting to like hear from like the specialist pharmacists, like why are these patients on these medications, or like why is renal function very important. So at the first year, I think I was just thinking about like nephrotoxicity, like as a side effect that we just like kind of need to memorize, but not really as like something that's really important. Like I got to through placement, I got to really understand that kidneys are really important. Like kidney function is really important to a person for the quality of life as well. So that's what I found interesting.
I was only really in 2 wards. So I was in the short stay unit, and then I was in a gastro ward. And I did enjoy both the wards. Each ward had its own like pros and cons. So in the short stay unit, the patients would only be there for a short while, as the name says, and so you don't really get to know the patient as well, because like after a while they'll get discharged to another ward, or they just get discharged home. And I would see like all sorts of patients, like, with all sorts of conditions, because it's not really a specialty ward. But whereas the gastro ward, it was just gastro patients most of the time, and you would see like from children to elderly people. So you would see how you would base treatment plans based on that.
Yeah.
And I do feel like both my supervisors did teach me like what to look out for in drugs, how you review a patient, interactions. Like I definitely understood more interactions and the importance of it,
Yeah.
and like how they do it, and like what to monitor in certain drugs. Like before they like prescribe a medication, they would walk me through like why they would monitor, like say magnesium for omeprazole, and they just highlight the importance on me, which definitely made me aware like, oh, I need to look out for this when I'm a future pharmacist. And it did just give me the opportunity to understand more like what a pharmacist does in both these wards.
It's the first time going into a setting like this, and obviously that comes with its natural challenges. When you started the placement, do you think the pharmacy lecturers and the staff here supported you in terms of workshops and guidance well enough for you to kind of make the most of your placements?
Yeah, definitely. It was through the kind of pre-placement induction sessions we've had, like leading up to placement. So not even just that, also through like normal like clinical workshops we had throughout the year, but it got like really more tailored leading up to placement. And then during placement as well, we had like a 1 day of a week where we had like a university day where the lecturers would check on us on our progress, what like if we have any concerns about our placements or anything really. It was a general checkup. So there was a lot of like but leading back to the question, we got really well set off for placement. Like they would tell us like what the placement providers expect from us, what the university itself expects from us to have like done in placement, and basically just preparing us through clinical workshops to know how like to communicate properly to patients, how to interact with patients, and as well through like different things like, you know, like drug histories
Yeah.
or, you know, like full history taking of a patient, which we didn't really get to use much in hospital, I can't lie. But it was like, it was a nice thing to have been prepared enough to be on placement, because I felt like we were not really thrown in the deep end when we went in. Like we were kind of confident, not confident enough, like not fully confident.
Yeah.
I mean, obviously it was a new thing for us, but it just felt like it was a gradual,
Yeah.
like
Kind of
progression.
easing in.
Yeah, easing in into like placement. So
I didn't feel like I was thrown in the deep end, but I feel like since we were the first year, I don't even think like anyone could know what our experience would have been like. It's the first time that we've been on a 13-week placement. So I don't think we could have really, like, I didn't feel fully prepared, because when I went in, I didn't even know what to expect, because we're the first year there.
Yeah.
So I feel like on the university's part, they like gave us the right training on the stuff we need to be looking out for, like SOP wise and things like that. But I feel like when it came to what to do there, it was mainly up to the hospital, like, or the place you're in, because I know different places did it differently.
Yeah.
So I felt like I just had to learn on the go what I needed to do, just because I know every hospital is different. So obviously university can't prepare you for that. It's based on the hospital. So I kind of had to go in and just, they kind of had to tell you what you have to do. But it's not like, after a while you start to pick it up. So it's not something I would worry about, because they support you all the way through. But to start with, I wasn't really sure.
Yeah.
Because it's not.
No, that's fair enough, and I think like you can't. Obviously, we had a cohort of students, and some in community, some in hospital. But even if you look at hospital, like you guys had completely different experiences, and well, hearing back from what you guys mentioned, and so you can't. Well, we couldn't really prepare each student perfectly for each placement.
Yeah.
But I think that's the learning curve, and that's what we're preparing students for, is to adapt. So then after you finish your degree and you go to work in different hospitals or wherever you may go, you should be able to adapt really quickly. And then that transition between university and working should be a lot more smooth.
Yeah.
Before you guys even went on placement, did you have any ideas as to where you wanted to work in terms of after pharmacy?
not really for me. Yeah, I was like, I'm gonna use the university, like the 13-week placement. It was like mainly what driven me into like University of Leicester, because then I could properly see what each sector is. So I was like, 1 year I'm gonna do this, 1 year I'm gonna do that, and then the other I'm gonna do this. So basically to completely know by the end of like my 4 years what year I want to do my pre-reg in, like where I want to do my pre-reg in. So until now I still don't know where I want to go, but like I feel like hospital was a nice experience. Hopefully even my next placement in community will be a nice experience as well. So
yeah, I wasn't sure either. I always had goals in mind of what I'd like to achieve in the future, but I always thought that I can just experiment in the future, like with different pharmacy careers. 'Cause pharmacy is it's a very broad career that you can go into. There's so many options. So I thought I would try them all and just like find the one I like. But I'm grateful that university kind of like makes me save time basically by providing this study placement, because I get to experiment while I'm studying. So I get to see like, is hospital the right fit for me, community or GP, which I'm kind of grateful for.
Thank you all again for coming. I really, really appreciate it.
Yes.
thank you.
Yeah.